Hello Grand Rapids, if you're out there, you're a mama, you're growing a baby, then this message is for you. Today we're going to be talking about the top symptoms associated with pregnancy, especially that we see in our office. We're going to be talking about low back pain, hip pain, sciatic, round ligament pain. We're also going to be talking about digestive issues. So if you have these issues, stay tuned. If you don't, but you know someone who is pregnant, then send this message to them, because we specialize in prenatal, pregnancy, family care, and we see every single day, every single week, all the mamas out there that are not living up to their full potential as far as a pregnancy experience. And there's more and more research out there that shows stress throughout the pregnancy period can affect baby throughout their delivery and early childhood years, can affect their brain development, and so on and so forth. So today we're going to be talking about how to get you out of pain so you can have the best pregnancy that is possible, so we can be up to our full potential, okay? And so first we're going to be talking about low back pain and hip pain. 90% of pregnant women experience low back pain due to postural changes, so weight distributions and ligament laxity. So that's from the evidence-based complementary and alternative medicine. And so 90%, so this is a very, very common thing. You're not alone if you're experiencing that. And every single, again, day and week, we see women that come in with these kinds of symptoms, and through gentle alignments, through evaluating the pelvis and the nervous system, through neurologically based chiropractic, we're able to help these women, and it's so cool. In fact, studies show that chiropractic adjustments can significantly reduce back pain during pregnancy, improving pelvic alignment, and reducing nerve stress. Do you think that's going to help during the pregnancy period? Yes. Next question, do you think it's going to help during the delivery? Yes, if we have alignment in that pelvis, we're going to have an optimal, best that we possibly can as far as scenarios go, delivery. And so that's massively important. And that was sourced by the Journal of Manipulative and Physiologic Therapies. And so when it comes to back pain and how the science behind that actually works and how the nervous system works, is the brain is up here and it talks to the rest of the body through the spinal cord and out those nerves, and through postural changes and through a growing baby, it creates disturbances in that nervous system and misalignments, and that can create all sorts of tension and stress patterns that have never been there before. And so by evaluating the pelvis, evaluating the nervous system, and we do that through our special technology in our office called Insight Scans, that allows us to be neurologically based and see, this is how your nervous system's functioning. Do we want to have the most optimal pregnancy and delivery that we can? Then we need to allow that nervous system to function at its best. We need to be in really good optimal alignment, and that's going to give us the best scenario for optimal outcomes. And so that's relating chiropractic to low back pain and hip pain. And we see so many cool, amazing moms and families who come in who say, they couldn't walk. They couldn't, whether it's your first or your second or your third, especially second or third, you also have to take care of these other kiddos too. And so running around trying to lift, bend, twist, change other kids, and you yourself are hurting and in pain, the quality of life is suffering. Through chiropractic and actually allowing the body to be in alignment, we're able to do life. We're able to chase the kids around the house and keep up with the demands that, aren't going to go away just because we're pregnant. And so we have testimonial after testimonial of amazing stories where these women are able to, again, be their optimal self so they can do life. And so the next one we're going to talk about is sciatica. This is the pain, shooting pain, discomfort going down the back of the leg, why it happens. So this is pressure from the growing uterus that can compress the sciatic nerve, and that's causing sharp pain that radiates down the leg. And so how chiropractic helps, and it's very similar. So the body just expresses itself in different ways through pain, and that's the body's way of saying, hey, we have a problem. It's like the body's way of raising its hand, trying to get your attention. And one of the best ways to get your attention is through pain. And so a lot of times misalignments, nerve interference, things like that, that's the root cause. That's what's happening in the first place. And your body manifests different symptoms or different ways of saying, hey, we have a problem. That helps us pinpoint where those problems are, whether it's low back pain. Sciatica, again, is more in that sciatic nerve coming from L2, 3, 4, going down through the piriformis. And so that growing baby can create compression in there. And so by aligning the pelvis and actually allowing there to be optimal positioning, we're able to relieve that tension from the sciatic nerve, allowing it to heal and be optimal. The research shows that gentle adjustments relieve nerve compression, helping up to 85% of women experiencing relief from the sciatic pain. So that's from the Journal of Chiropractic Medicine. And that's a really cool study. And again, that shows that whether you have pain or discomfort, it can be better. Maybe it won't be perfect, and maybe we'll have to get a series of adjustments in there in order to allow the body to function like it should. But there is hope. There's hope for actually having that pregnancy and delivery that you're wishing for, because nobody wants to be, yep, I'm pregnant, I'm gonna be in pain and discomfort, and that's just how it's going to be. So when we allow that body to get back in alignment and that nervous system to heal like it should, then we're taking pressure off that nerve, and that's when we can be optimal. And so the next one we're going to be talking about is round ligament pain. So the round ligament is on the anterior, the front side, down at the bottom lateral sides, the sides of the belly. And these ligaments get stretched out. They're near the broad ligaments, and they become very tight, tender. So the reason it happens is the ligaments to the uterus stretch. They stretch rapidly, all right? And that's leading to sharp pain, that's leading to discomfort. And so one of the techniques that me and Dr. Crystal, my wife, are both certified in is called the Webster technique. This is a very important one for balancing the pelvis, creating balance throughout the kinetic chain, and getting these round ligaments and broad ligaments relaxed, okay? Because they can expand so fast that there creates tension and knots, and it creates unevenness. And so the Webster technique, it's a specialized pregnancy chiropractic method. It helps reduce ligament tension, improves overall pelvic balance for a smoother pregnancy and delivery. So that was sourced by the Journal of Pediatric and Maternal Family Health. And so this is all research-based, team. There has been case study after case study and research showing this is what's going on, and this is how chiropractic can help. Not because chiropractic is trying to address a symptom, but because chiropractic is addressing the nervous system and allowing alignment to happen so that the body can do what it was naturally supposed to do. Women have been giving birth forever, right? Since the beginning. And so the body knows, it's infinitely wise, and we're able to tap into that wisdom through the nervous system and allow the whole process to unfold as naturally as we possibly can, and having this optimal birth and delivery and pregnancy. And so the next one we're going to be talking about is heartburn and digestive issues. So again, as baby grows, everything gets tighter and squeezed in, and especially the stomach starts moving up into the diaphragm, into the esophagus. So hormonal shifts along with pressure in the digestive tract can lead to reflux and bloating. So again, another just mean way that the body's talking to us, letting us know that there's a problem. If we can adjust gently that stomach, especially in the back, the nerves going to the digestive tracts, increase motility, allow it to be as optimal as we possibly can, we can create comfort, and so that you can be relaxed. You as the mom, your main job throughout pregnancy is to be parasympathetically dominant. Parasympathetics is that rest and digest nervous system. If we're in pain and stressed out, and fight or flight, then it's going to have negative effects on development in the whole pregnancy and delivery. And so we really want that rest and digest nervous system to happen. And when we are pain-free and in alignment, that nervous system is doing good, then we are able to really embrace, again, pregnancy, delivery, and that's the best thing for the baby as well. And so we use our insight technology that allows us to be neurologically focused chiropractors, seeing how the nervous system is doing, how alignment, how tension throughout your body is doing, so that we can make those gentle, specific corrections. So if you've listened to this, if this is ringing true, if maybe we can take a step up in your pregnancy and really allow you to embrace that rest and digest, relaxation, awesome pregnancy, then we are more than happy to help you. Reach out to us through direct message, give us a call, email. Let us know if you have any questions. We're here for you. We are a resource. My name is Dr. Sean Medlin. Have a fantastic day.